Kidney disease, the myths and facts about a chronic condition. The kidneys are small organs in the body, typically sitting on either side of the spine. We often do not think much about them until they start to malfunction. Most people cannot even name more than a single function of the kidneys, nor can they name the most typical and common symptoms of kidney disease. They do not know the risk factors that can precipitate kidney disease. It's important to know all of the factors related to kidney disease. It is also important to know what a kidney does and what can happen when they go bad. It is also important to know that even though kidney disease is often a chronic health problem, it does not automatically have to be terminal. You can actually bounce back from it. The function of healthy kidneys. There are a number of functions that the kidneys perform. They filter the blood of all impurities. The kidneys play a role in the regulation of blood pressure and also in the release of a number of various hormones. Because the kidneys both fulfill the same roles, it is possible to live with only one. When one kidney falls victim to kidney disease, the other takes over its function. This does put additional strain and stress on the remaining, healthy kidney, which in turn puts you at higher risk of developing kidney disease in that kidney as well. Signs and symptoms of kidney disease. While the kidneys play a large role in the function of the body, they are often credited only with those functions related to the creation and elimination of urine. This is one of most common and most well-known symptoms that can signal a problem with the kidneys, a change in urinary output either as an increase or a decrease. While there are certainly other reasons that you are urinating more or less frequently or have more or less urine output, it is certainly reasonable to consider kidney disease as one of the first conditions that is checked for. Other symptoms that should not be ignored can include pus or blood in the urine, cloudy or dark-colored urine, pain in the lower back that is not related to movement or possible muscular strain. A change in blood pressure. You cannot self-diagnose as kidney disease. There are a number of tests that will be completed to confirm a doctor's suspicion of the condition. After the tests either confirm or rule out a problem with the kidneys, the doctor may order further testing which will determine the actual stage of the kidney disease. Knowing the staging will help the doctor to plan a course of treatment which will include a change in the way that the patient eats. How diet is affected by kidney disease. Healthy kidneys filter out impurities, including those that are caused by the digestion of certain foods and some types of foods themselves. When there is kidney disease to deal with, the body often will need help, which includes using a different type of diet. In the early stages of kidney disease, a simple wait-and-see approach may be taken, while in the late third and fourth stage, lower protein is suggested. At this point of the disease, protein is limited so that the body does not have to work as hard to digest it. However, in the later stages of kidney disease, the need for protein will actually increase, giving the body the strength to fight back and a stronger immune system that is necessary to prevent disease. Blood pressure and kidney disease. Chronic kidney disease, often called CKD, is directly related to blood pressure. High blood pressure, medically known as hypertension, can cause CKD, and CKD can cause hypertension. Anyone who has problems with high blood pressure should take more care with their kidneys. There are groups of people who are higher risk for both high blood pressure and kidney disease. These groups should be even more vigilant about the signs and symptoms of kidney disease. African Americans and other ethnic groups and people with other chronic conditions such as heart disease or diabetes may also be at higher risk for developing kidney disease. How diet can help prevent high blood pressure and kidney disease. Diet is a very important factor in a healthy lifestyle and can help a person prevent high blood pressure and lower their risk of kidney disease. Kidney experts suggest following the DASH diet, which is high in fruits and vegetables, lean proteins, and other healthy foods but low in sodium and fats. DASH stands for Dietary Approaches to Stop Hypertension. Diets that are high in fats and sodium can increase the risk of not only high blood pressure but other related problems, including a higher risk of kidney disease. Opting for a lower-fat version of a food can be a better way to eat and can help you prevent some of these serious conditions. Treatment for kidney disease. The most common types of kidney disease are kidney stones and minor kidney infections. In the case of smaller stones, the doctor may simply encourage additional fluids so that the stone can be passed by the patient at home. For larger stones, the doctor may suggest breaking them up with ultrasound or with medications. Surgery may also be required in some very serious cases. For other, more serious kidney types of kidney disease, it might be simply a matter of changing the diet and monitoring blood pressure and other vital signs. Medications may be necessary, and in some types of kidney disease more serious types of treatment such as dialysis may be necessary. Protein supplements and kidney disease. While eating a healthy diet can be very trying, it might be necessary to include supplements to get to the right amount of certain types of foods. Protein supplements like ProfectR and ProsisR from Protica can help you get the right amount of protein without having to consume too many calories or the additional ingredients like fats and sugars that can make other supplements a problem for many people.